Rosacea is a really quite common and I think underdiagnosed inflammatory skin condition. There are many different types of rosacea, from simple flushing to the appearance of fine red blood vessels called telangiectasia on the skin, to something that can look a bit like acne but is actually papulopustular rosacea, to overgrowth of the nose, and in extreme cases it can even impact on the eyes in something called ocular rosacea. It can happen at any age, but it's more common in women, more common in paler skin types, and often onsets around the sort of time of perimenopause thanks to hormonal shifts, but that's not to say it can't happen to older or younger people. The most common triggers people tend to find are emotional stress, heat and sun, I would say the two, possibly independently, possibly separately, and then diet related things. Take for example alcohol or spicy food. And another really common story I hear is reactions to skincare products, and this is because rosacea impairs the skin barrier, and so products can have more of an irritant effect. And one thing I hear so often from rosacea patients is, I've spent a fortune on different skincare products over the years and they're all sitting in my cupboard because after a couple of uses they irritated my skin and I had to stop using them. So it can be very, very frustrating. So if you are struggling with rosacea, you'll be pleased to hear that from a skincare perspective, I tend to keep things very simple. You want a simple, hydrating, nourishing moisturizer. I will usually go for a very gentle cleanser, nothing that's going to strip, and definitely nothing that has SLS in it, sodium lauryl sulfate, which can be quite irritant. I will then tend to stick to very gentle ingredients. So my go-to products are the Red Apex Concentrate by Mida Beauty, which has got a truffle extract in it, which is extremely good and soothing for rosacea-prone skin, as well as various algae. Very clever mix of lab-derived ingredients and botanicals. And then the Sente Dermal Repair Cream, or the ultra nourishing version, and this contains something called heparan sulfate analog, which has been shown on studies to be extremely effective for rosacea and is another component of the extracellular matrix, like hyaluronic acid is, which everyone's heard of. If you're looking more generically than those products, focus on the very simplest of ingredients, thinking about just very gentle ceramide based moisturizers. Don't include actives. PHAs or bionic polyhydroxy acids can be a good choice as well, like in the Neostrata Restore range. This can be really nice for rosacea, but things like retinoids are a no-no. In the acute inflamed stages, don't go there. I would also always advocate taking high-dose omega-3 supplements, because these can be really nicely anti-inflammatory for the skin and help to calm it down quite quickly. And another useful supplement to take could be zinc. Make sure above all else that you're using a good sunscreen, and for most rosacea sufferers, a mineral sunscreen will work more effectively than a non-mineral sunscreen. Sunscreen is one of the most common culprits I find with rosacea sufferers, and they often find it quite hard to find one that works, but sticking to a mineral sunscreen will certainly make life easier. And then practice avoiding those triggers. Once you've identified what your triggers are, avoid them. If you have a more severe case of rosacea, then it may mean that you need prescription interventions, and this could be antibiotics, either topically or orally. It could be a treatment called ivermectin, which can be used topically to reduce the levels of type of mite, the Demodex mite that lives on the skin. And it could even, in quite severe cases, be a course of Roaccutane, which is a prescription medication more commonly used for acne, but also very effective in lower doses for rosacea.
If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.